Good morning, everybody. I'm not sure I'm going to be an upper on this conversation, but when Ann started as president of NYAM, she came to my office for our first meeting, and she said, Ashwin, I want to focus on climate and health. And I think you arrived at a time when obviously COVID was still swirling, Mpox was raging, many other challenges going on. I think I just unpacked our life expectancy data and was kind of still scratching my head. And so sometimes when big existential challenges like this face us, it can feel overwhelming, particularly from a seat of local leadership, but that has a national and international platform. It is obviously climate change and its causes and its impacts are felt far beyond the borders of New York City, and sometimes I feel like, what can we actually do about it? Especially when we're talking about climate change mitigation strategies. But what is clear is that there's a massive effort underway and has been underway here in the city to ensure that we are the most resilient and adapted city to our changing climate so that we can save lives. And so disregard the date because I actually just gave this talk up at Yale last week, but it's timely because it is a chance for us, you're here in New York City, to kind of use our local grounding as a way to speak into the very specific needs of our city, but to speak out on how this massive issue that can feel hard at times to get your arms around, especially for health people who are sometimes asking themselves, what's our role in this? What's our seat at the table here? Which is kind of the conversation that Ann and I had when we first met. What do we have to do about this, and why are we uniquely positioned to help? So I hope that I'll go through some slides that, one, kind of take you through some of the work we're doing here in New York City and set the table for what is looking like will be a great day, and also give you a sense that there are things we can do, and there is a sense of control, that we are not powerless, and that you all have a role to play in this. So I want to first just thank Ann for having us here, thank Joe and the sponsors, and I'm so glad that Carrie Olson and our team from the New York City Health Department is here to represent this work so effectively. So I'll try to do it justice here today, and I'll see if I can advance slides. Excellent. So I don't have to tell you all here that climate change is already happening. It's projected to worsen, and went through some of the issues in which it's, in the ways in which it's coming to our doorstep. Extreme weather, in particular, extreme heat, extreme flooding, and as we saw last summer, an unexpected visitor in the form of extreme air quality deterioration, infrastructure impacts like power outages, extreme precipitation days, I mean, name it. And we haven't even started to talk about disease vectors and our shifting burden of zoonoses. We had the first domestic cases of malaria, I believe over 10 cases in the United States last year for the first time in over a decade or more. And so we have to tackle this using the tools of public health. And I think we're at a moment where people are finally paying attention. 28 years into having these COP conferences each year, we finally had a declaration on climate and health. And you might say, okay, it's another UN declaration, what's behind it? But I think what it is a recognition that the people who have focused most of their lives on the issues of climate change, the folks who are worried about carbon regulation and emissions and changing the economics and the incentives around carbon emissions and increasing our temperatures, are actually saying, how can we tell a story that's more present day? How can we work against future discount bias that finds it hard to think beyond 5, 10, 15-year cycles and actually say, no, this is killing people today. And so I think this climate and health declaration is actually quite a momentous step forward. And 123 countries have signed on, and I hope that it's the catalyst for a whole body of work and action. Climate change is also killing New Yorkers, and deep, deep inequities underneath that. escalating flooding, power outages, heat waves, and not just, and as I'll show you, not just extreme heat days, but elevated heat days, chronically elevated heat days. We see a number of heat-related deaths, for instance, that happen at nighttime, when people are sleeping in elevated temperatures rather than exposed to extreme temperatures during the day. So it's very pernicious and is killing people every single year, every single day, every single year in this city. Traditionally, we have focused on environmental health as a way, public health has focused on environmental health as a way to modify exposures in the environment to reduce the risk of disease and to save lives. But the act of public health doesn't necessarily have the levers to modify the exposure to climate change. What we can do, however, is change our response and adapt to an environmental exposure that seems to be, hopefully it's in our collective control, and I know that you're going to be talking about the role of health systems today as carbon emitters and what it can do to green up its infrastructure and workforce. But we've got to get much smarter and much better at adapting to an environmental exposure of a changing climate, which is, at this point, a little bit out of control. Our climate work here in New York City, therefore, and has been around for more than a decade, addresses 6 principal areas of work: heat, energy insecurity, air quality, community climate resiliency, flooding, and vector-borne disease. And I'll just focus on the first 4 today. How do we work here in New York City? Focus on applied climate-related public health research and health impact assessment. Data is our superpower, as I like to say, and we use data as a convener, as an organizer of our work. Policy development and advocacy, community-centered programs, and environmental data communication. So let me talk a little bit about heat. Obviously, we know that heat waves are more frequent and longer than normal. Approximately 350 premature deaths happen in New York every single year. 7 heat stress-related deaths. Those are directly related to heat rather than an exacerbation of an underlying condition due to heat. 450 heat-related emergency department visits, 150 heat-related hospital admissions. So obviously our health systems are catching the burden of a changing climate and a rising temperatures around us. And Black New Yorkers are twice as likely to die from heat-related effects than white New Yorkers in this city. So structural racism is very much alive and well in this issue of climate change. And as I alluded to, it's not just the extreme heat days that are a cause for concern. It's a rising number of non-extreme but elevated temperature days that are also causing increases in morbidity and mortality. Nighttime temperature is one aspect of risk. And when we start to look at the attribution of these deaths, about 115 of our 350 deaths are actually due to these, or on these extreme heat days, but 230 are on these non-extreme heat days, because you have to look at the lag in relationship between the heat and the event, which can be up to 72 hours. So this is not just about these extreme weather events, it's about the chronic rise in temperature all around us. And it's not just a physical health issue. It's a behavioral health issue, an issue that obviously has been very important to me during my tenure as commissioner. And before, 63 of those 350 deaths, about 17% of our excess deaths, are actually related to mental health risk. And we're seeing increases in hospital admissions across the board for severe mental illness, schizophrenia, bipolar disorder, dementia, and mental health and substance use issues overall. So the idea that this is just affecting our bodies is obviously not true. So how do we do heat surveillance and research here in the city? We provide syndromic surveillance, for instance, on heat-related emergency department visits. We provide regular updates to our partners in New York City emergency management, and we try to get a better understanding of the impacts and how to predict the impacts of extreme heat days that we know are coming, and to pre-position efforts, particularly within our public hospital system, but also working with Greater New York Hospital Association to get their emergency departments ready for their members' emergency departments ready for anticipated heat wave days. Obviously, we can also position community community assets like opening up more cooling centers and so forth as we see heat-related days coming. But it's important to look at our emergency department visits as one harbinger of that. Weather-related forecasts are obviously really important, but heat-related ED visits and emergency EMS calls are obviously really important too. We make nearly real-time data available to the public as well. So I know we have journalists here today. That's essential because we need every conduit possible to communicate to New Yorkers to ensure that they can also take individual choices that are healthier while we work on the structural issues as well. We also calculate a heat vulnerability index, which is a composite index of green space, tree cover, poverty, race, because we know that that correlates, and surface temperature to look. This HVI index determines where we put cooling centers and where we pre-position assets, which community clinics, FQHCs, and health systems we work with to anticipate challenges. And the city uses the HVI to prioritize other climate-related interventions like the Mayor's Office of Environmental Justice and others. What do we do in response? Well, I know it sounds kind of silly, but it's actually incredibly powerful. Air conditioning saves lives. So this is the issue of local control. What can we do today to save lives, which is our goal in public health? We know that the presence of air conditioning saves lives in extreme weather, and so we've worked to distribute tens of thousands of air conditioning units all across our city with a special focus on our public housing infrastructure because we know that that is particularly vulnerable. I'll move through some of these other slides. Our maximum temperature policy has also been quite a success. Now we're working on implementing it, but the act of getting a maximum indoor temperature agreed to in our building code and throughout city policy is a huge step forward to reach that goal of having that implemented across all city buildings, non-city buildings by 2030 is a huge step forward. Let's talk for a moment about energy insecurity. It's impossible to talk about rising temperature without talking about the needs of the cost of energy, especially for cooling. We have worked very closely with our public utilities on rate restructuring and other policy avenues, along with the mayor's office and our home energy assistance programs to subsidize energy costs for families at greatest risk, families with chronic diseases, families near the poverty line, families with co-occurring chronic illnesses. We used our data to support the Public Service Commission petition, which secured over $70 million in utility subsidies for the lowest income New Yorkers, and this kind of work is essential. Let's talk briefly about air quality. We have the largest urban air quality survey in the world. I think London might be competing with us. Millions of data points that track particulate matter and pollutants in the atmosphere. And on the basis of this survey, we've been able to work in very targeted ways. As you can see, between 2009 and 2021, we've had dramatic decreases in PM 2.5 and NO2 and other pollutants in our atmosphere on the basis of this real-time surveying. So we have EPA monitors at the top of buildings, and then we can get down to local level effects because we have our own air quality monitors on bus terminals and school buildings and lower levels so that we can get to more micro effects. One of the coolest examples that we've been working on is truck idling. Not something you would think about as a public health intervention, but Carrie and her team have done excellent work on this issue of identifying hotspots of pollution on the basis of using these more lower level air quality surveillance sensors. And we do real-time PM 2.5 air quality surveillance. This was critical during the air quality event last summer. We saw a massive spike in website traffic to our environmental health data portal because people wanted to know, what should I do in the face of these wildly fluctuating, wildly varying, and very severe deteriorations in air quality? And the fact that we were able to share real-time data was essential, and all of you were here, or many of you were here, or up and down the eastern seaboard for that. We see on June 7th last year, we saw this massive spike in ED visits for asthma, similar, but not a spike relative to where we were in the season, but not all that dissimilar to what we see during high peaks in pollen season. So why is that important to mention? It's important because doomsday predictions that were laid out as we started to try to predict the deterioration in air quality was a conversation topic between us and the healthcare systems. Should we be reserving beds for pulmonary care? Should we be getting more oxygen into emergency rooms? These were real conversations that were happening, and I know you're going to be dealing with health system preparedness today. And of course, we developed our own AQI guidance that we hadn't previously had for the public because we've never really had a deterioration like this, but states like California, Oregon, and others that deal with wildfires more regularly, we consulted with them. We consulted closely with the National Center for Environmental Health to develop this, and now this is a part of what we do in New York City, and so we're working on it. Let me move quickly through just something that I'm particularly interested in and proud of is our work using our air quality surveillance on mapping out congestion pricing, obviously a source of big political concern, but and some of the latest research showing that while reduced vehicle volume doesn't necessarily contribute to direct health benefits from better air quality, we do know that it does enhance public transport use, which obviously does improve health through physical activity and otherwise. And it's more broadly good for the climate because it reduces some of these hotspots that we've been seeing of particular pollution in dense urban areas. So we're glad that our air quality data was used to support this policy effort. And of course, mitigation strategies from the funding that will come through congestion pricing, like reinvestment into local asthma programs in the Bronx, renovating parks and expanding tree planting to increase tree cover in those high HVI communities that I showed you earlier. Let's talk briefly about social infrastructure. So much of managing our way through extreme weather is about how connected we are. This research comes deeply from the '95 Chicago heat wave and Eric Kleinberg's work on social infrastructure and connectedness of communities. From that, we looked very carefully at which communities in our city were experiencing the highest death rates in response to extreme weather and particularly extreme heat. And we created the Be a Buddy program, which pairs an older adult, a more vulnerable adult, someone with chronic conditions, with someone who is dedicated to checking in on them, usually a younger person, during extreme weather events, and more regularly, creating this kind of social relationship. We've also created a Houses of Worship program to link our faith-based organizations to do the same sort of thing, creating places of congregation and checking in on others so that they can ride out and protect themselves during extreme weather events. And our Community Resilience Advisory Network is a group of representatives from community organizations that meet with us regularly to collaborate and offer input about how they see the climate and environmental justice impacts of rising temperatures and extreme weather on their communities. So I want to end by saying this is really important to us as we tackle the existential issue of climate change, an issue that is, frankly, bigger than all of us. But as we think about what we can do here in a city and what we can do with this uniquely American issue of falling life expectancy for our peer countries, as you know, we are in an unprecedented reversal of life expectancy in America, and New York City is no exception. COVID, of course, explains much of this, but when we start to unpack the reasons why we're struggling to get back on track, you have to unpack other drivers, things like cardiometabolic diseases, birth inequities, suicides, violence, overdose. And it's impossible to talk about these goals and our effort to get back on track without looking at the indirect drivers here. And across the board, climate is having indirect impacts on physical and mental health conditions, as I tried to lay out. And so if there was ever another reason to care about this issue, if you are in the business of protecting population health, preserving individual health, or both, the idea that we can be on the sidelines of the climate conversation is just not real. And I know that you know that because you're here today having this conversation. So I hope that I've given you a very quick and very broad overview of what we're doing here in New York City. This is a climate-forward city in a climate-forward state, and we are certainly a climate-forward health department. But we are extremely eager to learn from you, to partner with you, and to look at ways that we can do more, because this is certainly an existential challenge that we're going to be passing off to our children and our grandchildren. And I want to make sure that I spend my time and that you spend your time tackling this. So thank you so much.